The maxillary incisors. The maxillary incisors are four in numbers, namely the lateral, the central, and another lateral. The maxillary central incisors are centered in the maxilla, where both mesial surface or mesial surface are in contact with each other. The central incisor is bigger and wider than of your lateral incisor. The central and the lateral incisors is also known as your cutting teeth, for its function is punching and cutting the food. Together with your canine, it is called anterior teeth. Central incisor is widest mesio-distally for the anterior teeth. Also, the labial surface of your central incisor is flat compared to your lateral incisor and canine, which are more convex. During the early eruption, the central incisors or the incisors presents this groovy ridges located in your incisal ridges called the mamelons. Chronology. The first evidence of calcification for your central incisor is around 3 to 4 months. Enamel completed is after 4 to 5 years. It will first be seen inside the oral cavity around 7 to 8 years old, and the root is completed around 10 years of age. The crown is 10.5 mm in length, while the root is 13 mm in length. The mesial and distal diameter of your central incisor is 8.5, while the cervical or the neck area is about 7 mm. While on its side view, the labio-lingual width of your central incisor is about 7 mm. The right maxillary central incisor has 5 surfaces, namely the mesial, which is in contact with your another central incisor on your left, the incisal, the one with the contact to your foot, distal, the one in contact with the mesial surface of your lateral incisor, the lingual or palatal, and the facial or labial, which is in contact with our lips. The first surface is towards the lips, which is the labial surface. For the mesial outline, the crest of curvature approaches the mesio-incisal angle. The crest of the curvature is the greatest amount of curve farthest from the root axis line. For the distal outline, the distal side is more convex than of the mesial side. The disto-incisal angle is not as sharp as your mesio-incisal angle. The profile of your incisal surface of your maxillary central incisor is straight and flat after the mamelons wear off due to function. The cervical outline of the crown follows a semicircular direction with the curvature or the convexity root-wise. In summary, in the labial surface of your central incisor, you can see your incisal edge, the crown, the cervical line, and the root portion. From the labial surface, let us now move on to your lingual surface. In the lingual surface, there are still your root, crown, incisal edge, the cervical line, with the addition of the cingulum, the mesial marginal ridge, the distal marginal ridge, and the lingual fossa. In our lingual aspect of the central incisor, there is still the presence of your cervical line with the addition of your cingulum, the mesial marginal ridge, distal marginal ridge, the lingual fossa, the labio-incisal edge, and the linguo-incisal edge.